All right. Hey guys, welcome to your 20-minute lecture on the digestive system. This is chapter 21, also known as unit 8, just chapter 21, but there's a decent amount of content here, so we're going to try to go pretty fast. Digestive system starts on page 424. The first big thing, okay, it's just the overview of the digestive system. This image here from the book as just mainly my concern for you guys is knowing that when talking about the digestive system, you can kind of break it down into two categories. The first category is digestive tract. Again, everything from the mouth all the way down its own loop system through the stomach, intestines, all the way to the rectum anus. Okay, as food passes here, it ends up in feces. That's the tract. And then we have other parts of our digestive system that are considered accessory organs. This includes the teeth and the tongue, but the liver, pancreas, gallbladder are the big ones. Liver, pancreas, gallbladder are accessory organs, meaning that they're not part of the tract, that food doesn't pass through them, but they play a huge role in having this process happen, right? So that's the big thing there. So that's the first page. Kind of moving on, we want to talk about page 424, digestive. Oops, sorry, the digestive process. There's mechanical and chemical digestion, and all this digestion process starts in the mouth. Okay, as soon as food's hitting the mouth, that's when it starts. And again, kind of the food that runs through the tract is kind of external to the body. It's its own like system as it runs through. You need to make sure that you've got the four layers of our digestive tract down pat. So from deep to superficial, mucosa, submucosa, muscularis, and serosa. Mucosa is our connective tissue layer. That's where the absorption happens. Submucosa is kind of where those nutrients filter into. So lymph, blood, nerve endings, all those kind of things. Muscularis is our double-walled muscular smooth muscle layer. That's all about kind of movement and peristalsis, the movement, the flow of our digestive tract, the movement, and then serosa is the outermost layer, just protective, that sort of stuff. This talks about the enteric nervous system, not focusing on that. Big highlight too is peritoneum. Okay, you want to make sure that with the peritoneum, you just want to have a general idea of peritoneum being the double walled layer of our digestive tract, pretty much covers the whole abdominal cavity itself. But to help cover each individual like looped organ or stomach to all of our intestines, we have mesenteries. These are branches of the peritoneum that wrap around each of those individual, and then the greater omentum is kind of this big sheet that hangs over the side. You want to key in on the word on the fast fact on page 425, ascites. That is accumulation of fluid in the peritoneal cavity. So that means in the peritoneum itself, accumulation of fluid, that is ascites, and that you could be seen in a right-sided heart failure patient, stuff like that. Okay. Again, here's the greater omentum, basically this fatty cushioning layer that lays over top of our intestinal tract, has a lot of blood flow through it, so it's there for absorption and protection. Whoops, too fast. Yeah, no, that's where I want to be. Okay. The mouth's talked about in 426. I mean, biggest thing was here is again, food digestion starts here. The uvula, I want to highlight, and the tongue, of course, play a huge role in chewing up, grinding up food. But the uvula plays a role in basically keeping the flow of food through the mouth to the back of the throat, keep it from going up past the soft palate into the nasal cavity. That's the uvula's job. And then with the mouth, really just highlighting teeth. You got 32 adult teeth, 20 deciduous teeth, or aka baby teeth. 20 baby teeth, 32 adult. Other thing is salivary glands. You want to know on page 426, at least that body work section talks about two different enzymes the saliva does. And again, the saliva's job is to moisten our food, turn it into a clump that we can swallow, known as a food bolus, and help to start the digestion process, breaking down stuff with those two enzymes in it. Big as far as all the glands that are salivary glands, the only big one I'd highlight is the parotid gland, this big guy here on either side of our face. It's talked about in this section. It talks about it and it makes a mention that the mumps virus specifically, for whatever reason, targets this area, and you can see a mumps infection is going to make these parotid glands swell and become inflamed. That's most of the big stuff with the mouth. Again, tooth anatomy, I'm not too concerned about that. An interesting fun fact kind of thing is that the tooth enamel, okay, like the outside layer, it's one of the hardest substances in our body, which makes sense about what our teeth grow through. So next we're looking at excuse me. Next we're looking at the pharynx. Excuse me. So pharynx, again, and we go through everything. Pharynx, big thing is just where the food bolus is passing through. But so far, we're looking at GI tract. We're talking about the mouth, and then we're talking about the pharynx. And again, the epiglottis, we talked about it with respiratory, but the epiglottis plays a big role here because the epiglottis is going to fold down and prevent that food from going into the airway, into the larynx, and to keep it on track on the posterior side to our esophagus. That's posterior to our trachea. On the path of food, the next stop is the esophagus. That's our muscular tube that runs from the larynx in the back of the mouth, larynx, all the way down to the stomach. Just a very long muscular tube. Highlight this, the lower esophageal sphincter, LES. We need that working well. This is just what helps close up and prevent backflow of stomach contents after we're eating. And that's why you eat a full meal. You don't want to lay down, that sort of stuff. That's its goal. But heartburn, indigestion, that sort of sensation is resulting from regurgitation, movement through this LES back into the esophagus. That stomach acid really burns and causes that pain. So talking about the stomach here is talked about on page 429. Big things I know is once the food, it's a food bolus as it passes, but once food gets here, it becomes this kind of semi-solid mixture and starts churning. What's known, the food, once it gets the stomach and on after the stomach, is known as chyme, or chyme is how it's spelled, but it's chyme, and it's highlighted there on 429, CHYME, chyme. Okay. Chyme is just basically the semi-fluid mixture of food after it's been broken down to this far. And there's a bunch of different areas of our stomach, and you kind of have a general idea of all of them. So that's why sometimes you'll see books refer to the lower esophageal sphincter as cardiac sphincter. One, because it's close to the heart, but two, because cardia is the name of this first section as the esophagus meets the stomach. But most books are going to go LES, lower esophageal sphincter, which helps you put where it's at. So LES here. The fundus is this upper portion of the stomach. Fundus, there's an actual procedure called a Nissen fundoplication that takes the fundus and kind of wraps it around the esophagus, and this helps prevent. This is a big treatment for severe regurgitation and acid reflux, but another discussion. The body is the main structure of the stomach, and then the pylorus is at the end, the very distal end of the stomach where chyme is about to leave is the pylorus. So that means this sphincter here, this muscular pinch off point that helps prevent backflow at the end of the stomach, at the most distal end, is the pyloric sphincter. So your big sphincters coming in, you got coming in LES, lower esophageal, and you've got the pyloric sphincter going out. Okay. And this is just, again, same picture of the stomach. This just gives you an idea of all the muscular layers of the stomach. I've been interesting to mention the rugae. Okay, these kind of folds in the stomach. They really are there for assisting with lots of surface area to do some breakdown, and they kind of help bounce food around to kind of help break it down even further. But again, at this point, we are digesting food, but at this point we're still digesting, meaning that we're breaking it down. Okay. At this point, we have not undergone any absorption yet. You see what I'm saying? Like nutrients aren't being absorbed from the food at this point. At this point, it's still focused. Our GI tract is still a sole focus on digesting, breaking stuff down, breaking down our food into nutrients. That's what it's focused on. So there's some specific stuff on page 430 and 431 that really get into gastric pits and how gastric juices are relayed. This is helpful, but I'm not going to be too hung up on this because we kind of have to pick and choose some things. But basically, if you hear gastric pit in the stomach, it's talking about these depressions in the rugae and the mucosa itself that have different cells that secrete different enzymes that help us. Mainly, of course, the big one we have mucus, but some of the bigger ones is like chief cells or digestive enzymes. The big one is your parietal cells. These guys are the guys responsible for the hydrochloric acid. and intrinsic factor, if you remember that, were pernicious anemia, if you recall that, for vitamin B12 absorption. But hydrochloric acid obviously is just basically to help kill any microbes that are swallowed in the food. It's going to kill that stuff off and help break down the food. That's the hydrochloric acid, but that makes our stomach contents very acidic, okay? High acidity. So interesting, but not a dire need there. And then there's some phases listed for digestion. Again, this is just showing as chyme, right? It's entered, it's chyme now, and then eventually it's going to go through the pyloric sphincter, slowly squirts, and then allows the rest of it to flow. But it has a certain amount of time that it sits in the stomach to churn and break down, okay? And then this is just talking about parts of digestion. You do not have to know this, but the cephalic, gastric, and intestinal phases. This is going to giving you the step by step as it makes it through the stomach. I'm not too concerned about that. Big thing for the stomach is the anatomy, the parts of the stomach, the two sphincters, LES and the pyloric sphincter. And then having a general concept of like, where does this content come from? Well, we have gastric pits that secrete enzymes, the acid, and mucus to kind of all help this process happen. I do want to mention, as far as the other big thing for stomach, is on page 431. Talks about peptic ulcer, that life lesson down there. You're going to have to know about peptic ulcers. So peptic ulcers or ulcerations in the stomach or even in the esophagus are ulcerations or ulcering through the lining. Okay. So injury, inflammation, missing layers of the stomach. Okay. So burning pain, stomach aches, things that you can think of that are related to like heartburn, indigestion. Untreated ulcers, if they're not treated, could erode all the way through the stomach lining and start bleeding and could potentially perforate a stomach or a bowel or something like that. But the big thing I want to highlight from that section about peptic ulcers are essentially, I mean, there's a lot of different causes for ulcers. You could even have stress that causes an ulcer. But one of the main culprits is a really resistant bacterium called Helicobacter pylori. Short is H. pylori. So H. pylori is often usually the guy that's responsible. This bacteria is really resistant, kind of can survive the acid, and this bacteria can get wedged down in those gastric pits and cause inflammation and irritation that eventually leads to an ulcer. So H. pylori is a big culprit in peptic ulcers. Another ulcer culprit is overuse of NSAIDs, the non-steroidal anti-inflammatories. Okay. The non-steroidal anti-inflammatories generally interfere with that production of mucus, and they're going to basically kind of limit the ability for our stomach lining to handle the hydrochloric acid that it's producing, and that kind of can inflame and erode parts of the stomach and cause an ulcer that way. So chemical damage, basically, like a chemical burn. And that's related to overuse of NSAIDs. So NSAIDs could lead to ulcers, to bleeding. That's your problem. You get an ulcer, you're worried about the lining bleeding or lining going all the way through the ulcerating all the way through the stomach lining. So that's why we worry about that. So this is a stop off here on page 432. We're kind of out of the track for a minute to talk about the organs all around this area, that these are accessory organs: liver, gallbladder, pancreas, accessory organs, not part of the digestive tract, but a part of the digestive system as a whole. Okay. So liver's talked about, to begin the session about the liver on 432. And with the liver, it's got a right and left lobe, but I'm not too concerned. You know that. So you can take half a liver and live. Like, you could donate part of your liver if you need to. But our liver does a lot of stuff, over 250 tasks. I mean, the big stuff that you would highlight for your liver is talked about at the top of the page, but storing and releasing glucose in the form of glycogen, right? Remember that? Processing vitamins and minerals, filtering toxins, that includes like alcohol and those kind of things, and then also recycling old blood cells and things like that. Those are the big kind of things. I'd highlight too the fast fact there: swelling and inflammation of the liver is known as hepatitis. Again, we have disease process called hepatitis A, B, and C, but they're talking about inflammation, infection of the liver, or inflammation, swelling of the liver. The diseases that specifically cause that, hepatitis is more of a symptom. It's a swelling, inflammation of the liver, not a disease by itself, but we do have diseases named for that because hepatic refers to liver. Anything hepatocytes or liver cells, anything hepatic is saying liver. Okay. Hepatic portal system, hepatic, this is liver. So hepatitis is inflammation of the liver. This is the posterior version or posterior view. And this is just kind of highlighting, hey, here's our portal vein, right? That portal vein, you remember from our portal system, is all the nutrient rich, still oxygen poor blood coming off of the GI tract, making a stop in the liver to get clean and toxins before it goes back to the vena cava. If you remember hepatic portal system, right? This is on page 433. There's a few things I would highlight from here. There's some names of stuff that you want to kind of have an idea of. So one is these are stacks of what's called little sheets of hepatocytes. So sites, right? Cells, hepata. We're talking about liver. So these are liver cells. Liver cells line this whole area. And again, they have big jobs, but what they're showing here is that each of these hepatocytes is organized this way. And it has kind of these, again, central vein where that flow is coming in. They have what's called canaliculi and sinusoids. They come back, and canaliculi come back to see us, don't they? So canaliculi are just basically canals that carry bile. Our big thing our liver does is produce bile, and we're going to talk more about what bile does. Basically, bile's job is to help start breaking down fat because fat's a little tougher to break down. But basically, you think liver, you think all those other things we talked about it does, like filtering out toxins, minerals, storage, and storage of glucose. And the big thing is production of bile for as far as specific to our digestive components. Okay. But this is just kind of giving you an idea of what's going on. Also, kind of hidden in our liver, we've got Kupffer cells. These are just phagocytes that are specific to the liver area. The big thing I think I want you to get out of this part is blood flow through the liver is that, okay, we've got portal veins dumping in so that blood can get filtered through. We do have hepatic artery feeding, okay, like feeding it actual good blood. And we have canaliculi or just deposits to kind of get bile out, but that's what they're doing. So like basically you kind of look at these mixtures of hepatic artery and portal veins as places to filter out stuff, right? And so most of my test questions are not too specific, but I would say hepatocytes, liver cells, Kupffer cells, again, are big phagocytes that hang out just in the liver. They're specific to the liver. Like I said, a lot of our macrophages are type of phagocytic cells that have specific places to hang out. Kupffer cells are your phagocytes of the liver. Okay. So let's get on to the discussion about bile. What does it do? Why do we care, right? So gallbladder, this is on the posterior side of the liver. If you look back at this picture, right? Here's our gallbladder. The gallbladder is like the little brother of the liver, okay? And it has a very easy job, so to speak. So this is posterior view, or excuse me, anterior view, looking with the liver removed. You have to imagine that the liver is basically like here, okay? Well, that's not even big enough. Something like this. That's a bad liver with its lows. That's a really bad liver, but you get the idea. The liver is kind of hanging out here. You can see that in this picture. Gallbladder discussion on page 434. This is where the bile discussion comes in. You can see the gallbladder, all this is hanging around. The gallbladder actually has a series of ductworks and the ductwork off the liver that actually intervenes or innervates with the pancreas. And then all this stuff ends up bile, and all the stuff that the pancreas creates ends up dumping into our duodenum, our first part of our small intestine we're going to talk about all together, basically. But I want you to kind of know these ducts. They're hard to know, but you're going to have to. The only job of the gallbladder, like I said, the gallbladder is just the little brother, just a sac that's off kind of behind the liver. And its job is just to collect bile that's made by the liver, store it, and help concentrate it, meaning that the bile and the bile salts that are mixing in there need to have a little time to like cook, okay? Because bile helps us break down fat. The more it has time to concentrate, the better it be. So if I have a high fatty meal, this guy's going to be full, and then it will squirt and dump its bile into here to kind of help with that high fatty meal. So the ductwork goes as we have hepatic ducts, the right and left. They're coming from the hepatic side of this, the liver. So common hepatic duct meets the cystic duct. Cystic duct, highlight, that is coming from the gallbladder itself. These cystic duct and the common hepatic duct meet together to form the CBD, the common bile duct. And the common bile duct is what intervenes and goes into the pancreas and meets up with the pancreas, okay? That's what I really want you to know, the duct system, okay? Why the duct system and why I care that you know it? Well, that's where we go into discussion about gallstones on page 434. Again, or not again, but gallstones, okay, are just hard masses. You probably heard of kidney stones, same kind of concept. Gallstones are usually come from excessive cholesterol. So basically, gallstones are just high fatty content made from, because the bile is kind of like made from cholesterol and fats, which is interesting, but it helps break down fats. Gallstones can be no problem, or they can cause signs and symptoms like even liver failure and stuff, because they'll block this duct, and now all that bile still gets made by the liver, but backs up into the liver, and then that bile backs up into the bloodstream, and that's where you get a problem. Now, you can, if it's a problem like your gallbladder is inflamed or infected, or there's a blockage and they can't get it out of the gallbladder, they can remove the gallbladder, and that's not a problem. You can live without your gallbladder. You still make bile. The bile is made by the liver. The gallbladder just stores and concentrates it, but it means that you won't have the storage of the bile and you won't have the ability to concentrate it. So if you have your gallbladder removed, you shouldn't eat high fatty meals, because it usually causes diarrhea, because you can't really digest fat effectively. But this is talked about in the life lesson, gallstones. And on that same, we talks about the body of work, talks about our liver makes up to about a liter of bile a day or so. But again, this is a yellowish green fluid that's bile salts, bile pigment made of cholesterol. The pigment of it is called bilirubin. Okay. Bilirubin is what happens if something backs up in the liver, or liver is failing. A lot of people get jaundice, this yellowing of the skin. That's because of build up bilirubin from bile into blood. That happens again if I have a gallstone blocking a stone made in the gallbladder, okay, from high cholesterol levels, that blocks this ductwork, backs up to the liver. That's what's happening, and they may get jaundice or liver failure. My bile gets made but backs up, and the bilirubin component of bile spills out into the bloodstream and flows through us and gives us the yellowing of the skin, the yellowing of the sclera of the eyes, that sort of stuff. That's where jaundice comes into play. But the big job, the word is not defined here, but the big job of our bile is what's called emulsify fat, emulsify, and that's going to be emulsification is talked about on page 439. We're going to get to that, but emulsification is the breakdown, okay, of bile, but it doesn't, or the breakdown of fat, but it doesn't break it down fully. It's like you have to imagine fat is like very buoyant, right? Resistant, hydrophobic, resistant to water. It's hard to break down. It's like a glob, like just a glob, right? So to break down fat, we need to kind of break it down in smaller little droplets first. And then it's easier for our body to break it down after that. But if it's all clumped together, it's very hard for our body to break it down. And that's the job of bile, to emulsify it. Emulsify is basically split it up into little droplets that we can easily break down. So we're going to talk about emulsification. So the last accessory organ, again, accessory organs, liver, gallbladder, its little brother, and the pancreas. Again, gallbladder is where gallstones come from, but the gallbladder's main job is just to hold on to some bile and concentrate it. The pancreas discussed on 435. For now, the big thing with the pancreas is that, well, we know it's an endocrine and an exocrine gland. The endocrine part we've already learned about. This is the exocrine part. The exocrine part is that the enzymes made by the pancreas are deposited into a ductwork system throughout the pancreas that meets up with this guy, the CBD, the common bile duct from the liver and the gallbladder, and then dumps bile and then dumps all of its enzymes into this one spot in the duodenum right here, which is the first part of our small intestine. This is the stomachs right here. This is where our content, our chyme has met. All right. So we want to talk about that. We're going to talk about, there's a great page that lists all of our enzymes. I'm not going to focus on them right here because all of our enzymes are listed on a chart on page 441, and that's where I would focus your study. But because the one thing I'll say here now is that the enzymes, the digestive enzymes released by our pancreas, they can digest all three types of main food groups here that we talk about, right? Proteins, sugars, and fats. They have the ability to kind of help break down all of those things. And that's why the pancreas can be very, very important. And again, theoretically, you can live without a pancreas, but it's a much more challenging than some other things. Okay. So we'll talk about enzymes more specifically. Let's get to small and large intestine, or kind of wrap this up. So small intestine, big thing I want you guys to know is the order of like their sections. Okay. The duodenum is how you say this. Duodenum is how I say it. Duodenum. This is the site of most digestive processes. So chyme comes off the stomach, right? At this point in the stomach, chyme and the food that we've eaten is still in the digestive phase where it's still breaking down. The last part of last part of our breakdown actually takes place right here first in the duodenum. The first part of our small intestine, this basically the duodenum is the first 10 inches, and you don't have to know how long each part is. Okay. Hear me there. You don't have to know how long each part is, but the duodenum is this first part is the main, like we've done digestion since we put the food in our mouth, but the main part happens here because we've got our bile and all our pancreatic enzymes dumping into the duodenum and finally breaking down everything as we're going to be broken down as much as it can. And that's what digestion is trying to do, break stuff down. So that happens here. Now, after this, we have two larger areas. The next one's called the jejunum. This is where most nutrients are absorbed. So we've broken down, we've done digestion, and the next 8 feet is the jejunum. 8 feet, crazy, right? Next 8 feet of our small intestines is jejunum, and that's where most of our nutrients absorption is. And then our ileum is the last 12 feet wrapped up, tucked in here tight of our small intestine. And their pyre patches are located mostly here. And there's still a lot of absorption of nutrients happening here. But most all of our absorption happens in the jejunum and some in the ileum. But again, the first part of our small intestine, the duodenum, is where most of our digestion finally takes place. It's been happening the whole time, but all of it, most of it's going to take place there. I want to make a point that the body of work section right here on 436 talks about peristalsis at the bottom. It talks about segmentation too. Peristalsis is that wave-like motion that our stomach or intestines do to help move food along. We also have an ability called segmentation to help constrict our intestines and help move. It helps move food, but it also really helps break down food more. Okay. So we're always kind of breaking food down to help with digestion. Big thing for small intestine is that's discussed right here on this slide. Big thing for small intestine is it just kind of looking at the lining and showing our layers. The big thing is how our small intestine looks. So if you zoom in on this, right, you take a layer of our mucosa and you look at it under a microscope, this is what you're seeing, okay? This is showing you that each cell in here has got these microvilli that line each villi. So imagine that the layers, like you see all these little hair-like projections, not hair-like, you see all these projections right here in this image. Those are cilia. I mean, oh my goodness, I messed you guys up. They're villi. Villi is the reason that we're able to absorb as much as we are. That this is like small projections on projections. So in our GI tract, it looks like this, and this allows for food basically to get for food to get down in here. Food gets wedged in here, and this is where the absorption happens. Gets wedged in here. So this increases our surface area like 100-fold, basically. And that's important. So the highlight there for me is from page 437 is just, do you have an idea of what villi are? Okay. Villi. All right. So most nutrients pass in the bloodstream through the capillaries that are traveled here. And again, they travel to the liver, the hepatic portal system, and then they go from there. So page 438, 439, and all that talk about chemical digestion and absorption. And what they're really trying to talk about there is just they're painting a picture of how all these components are broken down. And so they're good reference, but there's a chart that summarizes all this on 441, and that's where I would focus your study. So I would use the chart that's on page 441, and I would come back and use 438 and page 439 as a reference to kind of help use the pictures and stuff to put all those enzymes in perspective. But you're going to have to know them. Okay. You're going to have to know them. So, but this tells you what enzyme and where it's released and what chemical it's trying to help break down. Like example, like, what chemicals trying to break down sugars are saccharides, which again, sugars you got to put under carbs. Like there's so many names for sugars, but sugars like carbohydrates, sugars, those are all in the same branch. Proteins, amino acids, okay, those are all kind of in the same branch. And then fats, lipids, all those things kind of fall in the same thing. And that's where emulsification comes in for fat digestion, okay? So again, that key digestive enzyme chart is on 441, and it breaks it down really well. And I would try to make sure that you get that straight and use that reference page there. Last part, small or large intestine. This is where all the food has mostly been, all the nutrients have been absorbed, and what's left is like some undigested food that we couldn't digest, like corn is always there. Sloughed off epithelial cells, salts, bacteria that we didn't need or didn't want. That's what's going to end up in the large intestine. And then large intestine's big role is kind of getting rid of all that and turning our waste into stool, feces, so we can get rid of out of our body. But also its big role is a little bit, it helps a lot with fluid balance. So our large intestine is a spot where we can move fluid in and out depending on what we need, to make our stool a little more firm or less, depending on what we need, right? So the sections of large intestine are as follows. We come off the ileum, that last part of our large intestine. We hit the cecum here, this section right where this big turn is, the cecum. That's where our appendix lies. Another lymphatic tissues to kind of help that. We have the ascending colon. So ascending is like climbing the mountain, right? Transverse colon, so it folds over and transverses across our abdomen. Like this is like the picture frame that houses all of our small intestines in here, basically. Does another bend, comes down the descending, so down for descending, colon, hits the sigmoid. I always think of sigmoid because it's kind of like an S shape, kind of. It's not necessarily, but kind of an S shape for sigmoid colon. And then we have our rectum and then our anal cavity or anal canal. Okay. That's the so we go ileum for small intestine. We hit the cecum where the appendix is. We're now in large intestine. Ascending, transverse colon, descending, sigmoid, the S, rectum, and then anal. And we have an external and an internal anal sphincter. Why do you think we have two? I think I probably mentioned this in class, but we have an internal sphincter that's mostly smooth muscle that just reads, oh, I feel pressure from stool and feces. I need to go to the bathroom. And then we have an external one so we can control that. If we didn't have the two sphincters, we would just have an internal one that we just go to the bathroom all the time, which would be bad, right? We wouldn't have the voluntary control because that external sphincter is made up of voluntary muscle that we control. And then as we grow up and we get potty trained, right, we learn how to control this. So interesting. The other note I would say for this whole chapter on 441, you gotta look at that digestive enzyme chart. Got to. The other thing is I don't always highlight the changes with age in life lesson, but there's a life lesson changes with age on 441. Talks about our digestive tract and whole. There's a lot of muscle movement in our digestive tract, right? All of this weakens over time. Muscles get weaker and all those kind of things. Peristalsis slows. So constipation and hemorrhoids in the anal canal or around the anus from us as older adults try to push and put a lot of pressure in there. That's what causes hemorrhoids. But doing all that leads to constipation. So constipation is a chronic issue for elderly patients. So that's a good highlight. So that would be my 20-ish minutes video lecture. So that should cover a lot of the big stuff. Okay. Again, you're responsible for what's in the book, but this overall should help. And yeah, I hope this is helpful to you guys. Please let me know if this is helpful or not, what I could do better for you. If you took the time to watch this video, thank you very much. You guys got this. You can do this. I promise you, you can do this. I'm here to support you. And you guys have a good evening and God bless.